Welcome back. Keeping kids away from drugs and alcohol. Farmington High School has done just that with a new substance abuse prevention program. This morning we are joined by Edmond Freddy from Farmington Public Schools and Desiree Vasquez from SCD Prevention Works to talk about how this initiative is working. And you've actually been partnering together for a long time. So this has really, you've had a lot of years to look at this research. Thank you so much for being here this morning.
Thank you so much for having us.
Of course. So Ed, what made you bring FCD in to begin with, and what was the drive behind it?
Well, like a lot of communities, we've had some tragedies back about 10, 12 years ago, and then some parent involvement. We had some parents who led us to FCD's work, and we had them come in and do some direct work with students. And then and they do that every year. They come and do some direct work with students, and they offer us technical support. And then we also utilize a survey they have that gives us insight locally into what kids are thinking about their peers and drinking and what their actual behaviors are.
And Desiree, FCD, what does that stand for? And what do you do to make sure that fewer and fewer kids are experimenting with drugs?
Absolutely. Well, FCD stands for Freedom from Chemical Dependency. We were founded in 1976 with that moniker, and now take the moniker STD Prevention Works to highlight keeping healthy kids healthy, which is what we do in 70 countries across the world. What we do to do that is a lot of research basis. We stick to health. When we find that a health message is less labeling for kids, it allows them to step into their own because most kids are healthy. We also use on the survey that Ed was referring to something called the evidence-based social norms approach to prevention, which says that when kids understand that the healthy reality is most aren't using, they're more likely to just be themselves, open up to that possibility.
Obviously, many school districts dealing with heroin abuse and opioid abuse. Are you seeing that in your schools, or are you not seeing that because of this program?
Well, we see it in recent graduates and kids in their 20s. When we look at kids that have been out of school for 4 or 5 years, we hear about things that are happening. But alcohol and marijuana sometimes can be a social gateway to that. That's where they start experimenting with it, and they first come across oxy or things like that. And so there's a pathway and a trajectory that starts maybe in high school. Maybe not the actual heroin use or even the oxy use, but there's that trajectory that leads them to that later on.
And how have you guys have been formed since the 70s? So how have you been able to kind of combat the opioid crisis?
Yeah, well, alcohol use is the #1 drug used by students, and so Ed was saying if we can work upstream to talk with people younger about how alcohol can be a risky substance in and of itself, that delays the risk that could occur when a young person is exposed through the social network of drug use, other substance use. So by preventing earlier risk factors and having those kind of friendly, open conversations really early on, young people feel like they can ask questions about the risks of other drugs and gain skills to protect themselves later on.
And are you in other school districts in Connecticut as well?
We are in several other school districts in Connecticut, yes.
Wow, wow, incredible. Well, thank you so much for your time this morning. I hope that you continue to see good results with what you've been doing, and I appreciate it. Thank you.
Thank you.
For more information, you can always head to our website, WTNH.com. Just click on the On Air tab and pull it down to the Good Morning Connecticut Weekend section.